I'm Daniela Cabrera Palos. I'm a second-year resident at Hospital Ángeles Pedregal, and I'm going to present a case of thrombosis at the unusual venous sites, portal and splenic veins secondary to chronic pancreatitis exacerbation. Thrombosis at the unusual venous sites involves veins in central nervous system, abdomen, or intra-abdominal organs. This pathology involves different risk factors. The use of anticoagulation in this condition shows benefits in recanalization, lower thrombus extension rate, lower incidence of hepatic descompensation, and improved survival. The benefit of newer oral anticoagulants versus low molecular weight heparin is yet to be determined. However, the use of newer oral anticoagulants remains controversial. This is the case of a 57-year-old female with history of type 2 diabetes and chronic pancreatitis. She presents to the emergency room with an exacerbation of her chronic pancreatitis. During hospitalization, the patient persisted with abdominal pain with an increase in intensity, decreased peristalsis, abdominal distension, dyspnea, and tachycardia. For this reason, it was decided to perform a thoracoabdominal angiotomography, where it was reported acute edematous interstitial pancreatitis, Balthazar D, and partial portal and splenic vein thrombosis. It was decided to start anticoagulation with apixaban 5 mg twice a day. The diagnostic approach was performed by the hematology service, after which it was determined that the cause of the thrombosis was the inflammatory process secondary to the exacerbation of chronic pancreatitis. After started treatment, the patient presented complete remission of the symptoms 2 weeks after, with the last abdominal angiotomography reporting partial recanalization and collateral circulation in the site of thrombosis. Anticoagulation is the first-line therapy for symptomatic patients, providing benefits including prevention of bowel ischemia, reduced hospitalization, and improved survival. Anticoagulation is given for a duration of 3 to 6 months among patients with reversible etiologies, such as acute intra-abdominal process or trauma. Anticoagulation is initiated with infusions of unfractionated heparin or subcutaneous administration of low molecular weight heparin, and is maintained with oral anticoagulants or low molecular weight heparin. Rivaroxaban and apixaban are oral direct factor XA inhibitors that belong to the group of direct oral anticoagulants that are equally efficacious and comparable or safer for the initial treatment of VTE in relation to vitamin K antagonists. Oral preparation, lack of required pretreatment with parenteral anticoagulants, and no need for monitoring has led to the increasing popularity of these agents. With conventional anticoagulation treatments, recanalization occurs in up to 1/3 of patients, being more difficult to achieve when ascites or occluded splenic veins are present. The use of DOACs is being generalized, but they are not routinely used in portal venous thrombosis and are not yet mentioned in the latest guidelines as an alternative treatment. This new class of anticoagulants is safe, since the incidence of major bleedings and other drug-induced side effects was similar as in patients treated with conventional anticoagulation. In this case, and under apixaban treatment, a partial recanalization and collateral circulation was achieved in the site of thrombosis. Also, there was no bleeding complications reported. The use off-label of newer anticoagulants in this pathology prompts the comparison between the use of traditional and newer anticoagulants. Thank you.